Good morning, everyone. This is State Treasurer Dale Falwell. Thank you for muting your phones. Thank you for joining us for our local edition of Ask Me Anything. Most of you received the press release that went out regarding the topics we'll be discussing, which is a lot has to do with the Local Government Commission and late audits. Okay. Yeah, if you'll mute your phone if you're not asking a question. I'm sure we'll get a lot of calls about Wegovy and weight loss drugs and things like that are going on. Just left the Council of State meeting a few moments ago, and they talked about the budget proposals that have been submitted to the Office of State Budget. I want everybody on this call to know that as part of our legislative agenda this year, that we are going to ask the General Assembly to put in a match up to $25 per month for the 401 or the 457 plan. And I'm saying that as the budget writers are writing the budget, and there is about a 50% gap between the local employee participation in the 401 and the state employee participation in the 401. And you can't talk about being retirement ready when you have that big a gap. And I think one of the biggest differences is the fact that many of the local counties and cities actually match their 401 or 457. $25 doesn't sound like that much, but I think that's recurring over $140 million a year. And we think it's important for our plan to get people, do everything we can to encourage them to put money in 401s and 457s and to be retirement ready. With that, I'll be glad to answer any questions anybody might have. Just raise your hand. Ray?
Can you hear me?
Yes, sir.
Okay. Looking for an update on the status of the Wegovy, the GLP-1 talks. We hear that Novo's got an offer on the table, and we're wondering if you can confirm that and share any information about what sort of prices they might be offering if they do.
Ray, we are still in ongoing discussions with the big manufacturers of these particular drugs, and as I think many people have heard me say in the past, I thought I had my samples on me, but I don't. Many people have heard me say in the past, we're not questioning whether this drug works, we're questioning what we're having to pay for it. And those that teach, protect, and otherwise serve in this state deserve to pay the same price as the people back in Denmark, which is the headquarters of Novo Nordisk. So at the end of the day, we continue to be in negotiations with this. We do have some more data, Ray, that I think will interest you. Recent study found that Ozempic and Wegovy cost 95 cents, between 95 cents and $5 to produce, or no more than $22 a month. The list price for Wegovy is $1,350 a month. And after rebates, when we were covering this drug, our cost to the state health plan is about $800 a month. So you can see that this company has made the decision to put profits over public servants. And that's why we continue to negotiate with them. We have sent no less than a half a dozen proposals to our pharmacy benefit manager, as well as to these manufacturers of these drugs. But so far, every one of those suggestions that we have presented to them have been rejected. So let me give you a couple of simple ones. Number one is the body mass index. Now, we take obesity very seriously, but the body mass index, some of the protocols are in the high 20s. If you're thinking about a drug that is in shortage like this one is, it seems like you'd want to prescribe it to the people who have the highest body mass indexes, not the lowest indices. That'd be an example. We've been trying to shorten the amount of product that people get per prescription. As you know, by reading those studies, this drug doesn't suit everyone well. And it should be no secret to you that something that someone can buy for an $80 copay could end up back on the black market in Amazon Marketplace for a few $100. So those are just some examples of what we're trying to deal with. We are not questioning whether this drug works. And even when they flew across the pond to meet with us a months ago, they were talking about how this drug works. I said, we're not questioning whether it works or not. We're questioning what we're having to pay for it. And I said, if you feel so strongly about the cost benefit of this, why don't you finance the cost of this drug for 20 years at 1%? Because that's how long it's going to take for us to enjoy those benefits under your analysis. I will say in closing, Ray, that especially with the news that have come out in the last few weeks, when Cody Kingsley, the Secretary of DHHS for North Carolina, has seemed to suggest that this is something that Medicaid in North Carolina should cover. All the documentation that we have at the state health plan about what this is costing us, I think it would be helpful, maybe helpful to him to look at what it could cost for this to be covered under Medicaid. And you've also read some things recently about CMS and Medicare covering this product. So when you talk about a product where the ingredients are in short supply, the injectors are in short supply, the product itself is in short supply, and when you see this demand for this product going up, when it's all in short supply, you know, it's hard for me to see, based on what they taught me at UNC Greensboro, how the cost is going to be going down. Follow up?
Yeah, but in all of that, I was, can you share any information about what prices they've, what price concessions they've offered, if any, to this point?
I can't, not because I don't want to. It's just because I think that a serious question like that deserves a serious factual answer. And I would have to consult with the negotiators at the state health plan to get you a more definite answer about that.
Is that something that y'all will do down the line?
Yeah, when we have something to report on that, we would welcome the opportunity to tell you. Okay. Next. Ray, you have a follow-up? You okay?
I'm okay.
Okay, thank you. Paul?
Yes, sir. The the mayor and the city manager in Elizabeth City have said for the last 5 or 6 months that the past due 21-22 audit is in the hands of PB Mayors, their outside auditor. How unusual is that for supposedly the audit to be in the hands of the auditor for 6-7 months? And is that concerning to you?
Well, if it's true, it's concerning to me. As you know, and it's no secret to anybody on this call, that of my term as the state treasurer, that there are a lot of things that the city of Elizabeth City says that simply, at the end of the day, were not accurate. So I would think that if it were true, and I'm not saying that it is true, that would be concerning. I would tell you that there's a shortage of auditors across the state of North Carolina. And I consider Elizabeth City not only to be a port city, but regionally to be a very important city in our state. And I have said this in the past, and I'll say it now. It's time for them to figure out what's right, get it right, and keep it right. And that's all I hope for.
A couple of follow-ups. You'd mentioned late last year that referring the city to the Joint Legislative Commission on Government Operations was an option. Have you done that, or are you considering referring the city to them?
Yeah, this Joint Oversight Committee is an option. I think if my memory is correct, Martin County's been referred to them, and I would have no hesitation in referring Elizabeth City to them also.
And one more question, sir. The recent tax delinquent list that came out in Pasquotank, the city was listed over 50 times for delinquent taxes. relating to stormwater fees and solid waste fees. Is that unusual for a municipality to not pay those fees? And is that a concern?
It is a concern, and it's just another example. Paul, thank you for putting sunshine on this. All we really want out of Elizabeth City is transparency, competency, good government, and no conflicts of interest. That's all nothing more, nothing less. And I think that if there's information out there that shows that there's dozens and dozens of instances of them not paying their bills or not paying their taxes, I think that's a very serious concern.
All right, thank you, sir.
Thank you. Next, Bill O'Neill.
Good morning. I may have a problem on my audio end. I hope you can hear me, sir.
Yes.
I wanted to ask you if you would share your plans for the future. Do they include anything involving politics?
I will answer the question because you asked it. You deserve an answer. Number one. Number two, the Ask Me Anything call is typically not about politics, but I will say what I've said in the past, that coming up to the primary a few weeks ago, there are 5 boxes that I wanted to check. 1 is to know who I am. 2 is to know who I love. 3 is to know who I belong to, both on this earth and beyond. Number 4 is to be healthy. And number 5 is to win. So I checked 4 of the 5 boxes. There's a lot of things that need to be, I love saving and I love fixing. And there's lots of things that need to be saved and fixed back in Winston-Salem, and that's what I look forward to doing. I'll also tell you that I was on the job as the state treasurer the day after the primary on Wednesday because that's what the voters hired me to do. And so our goal around here is to finish strong. I have no plans to run for political office going forward. Obviously, that could change, but I do know that I love fixing and I love saving, and there's a lot of things that need to be fixed and saved around this state and around this country.
Follow up, please.
Yeah, sure.
Do you have any plans to support in any way the GOP nominee for governor?
I'll say what I've said before. I'm not going to waste my vote going forward in my life on anyone. I have said what I've said previously about why I thought I was the best person for the job. And it's up to the Republican nominee to prove to the voters, why, including me, why he's the best person for the job.
One more.
Sure.
Is there any way that you would support actively, either financially or even stumping the trail for the nominee for your party for governor?
Yeah, I don't think I'm going to be asked to do that.
Thank you.
That was 4 thank yous with the echo. Thank you, Bill. Next. Joe?
Hey, Mr. Treasurer, what is your message to the people who serve, protect, and teach in North Carolina who might be a little anxious right now with these drugs and their future up in the air?
My message to them is that we take our responsibility to be loyal and exercise a duty of care very seriously. We also have to make sure that we're doing the most good for the most number of people. And whether it relates to this particular product or any procedure that's out there, we're always, we're not just watching the pennies and the paper clips, but we're trying to do the most good for the most number of people. Joe, I think it's, if I haven't said this to you in the past, I think it bears repeating if I have. It's important to put this in context. There's nearly the cost of this one drug had the potential of costing us about $170 million this year. A 4% bonus to 250,000 retirees was also $170 million. So there's 22,000 people being prescribed this drug. There's 250,000 people getting a 4% bonus on the state pension plan from the General Assembly. Both of those are $170 million. That just tells you how gigantic this is in context. Follow up.
No, thank you.
Joe, I would follow up my own follow up by saying that in every instance of the last 7 years, we have always taken this responsibility very seriously. That's how we've been able to negotiate a fantastic Medicare Advantage product with zero premium to the member and no cost to the state health plan. That one contract saving $1 billion. We used that $1 billion to freeze family premiums for the last 7 years, not lower them, which was my goal, but actually freeze family premiums. So every penny that we save in the state health plan, doesn't get reverted back to the General Assembly. It stays in the plan to keep it solvent. And we've been able not just to freeze the premiums, but also offer that Medicare Advantage premium at no cost to the member and no cost to the taxpayers. So my reason for saying that is that we're constantly looking for ways to do the most good for the most number of people. But when you have certificate of need laws in this state that allow the cartel to control the supply of health care, they control the quality of health care, they control the access to health care, they control the pricing of health care and whether they break your kneecaps if you don't pay your bill. As long as all those things are continuing to go in the right direction, it's very, very difficult to sustain a plan like ours that is $34 billion in the hole just for the state health plan, according to the actuaries. I will say that Gene Woods and hospital executives across the state could snap their fingers and resolve this in a matter of hours. The General Assembly could resolve a lot of these issues in a matter of hours, not just increasing the quality and increasing the access, but lowering the cost of health care and not, more importantly, protecting the consumers against some of these unbelievable practices that are going on with healthcare billing. So, we long for the day when that occurs. But we're dealing with what we have with where we are, and that's where we are. I will also tell you, and the reporter asked me this at the Council of State this morning about the weight loss drugs that he said it seems like Bernie Sanders is saying the same thing that you are. And a few years ago, I was called by Politico being the conservative Bernie Sanders of the Republican Party. I think Senator Sanders is known for advocating for the invisible and talking about how these policies affect average individuals. How we approach these things are obviously completely different, but that's exactly the approach we take in the state health plan, is that we advocate for the invisible. So going back to your question, Joe, those that teach, protect, and otherwise serve, they're not invisible to me or to us. Connor?
Hey, Dale. Am I coming through all right?
Yes.
Okay. We ran into each other at the county GOP meeting at Forsyth County, and you mentioned this morning about saving and fixing. When you look around at Forsyth County and Winston-Salem in particular, do you think there's anything that stands out specifically that you think needs saving or fixing?
That's within the government's responsibility. I mean, obviously, I haven't had a chance to think about that, Connor, but I think if you were asked my wife that, she'd say our yard. So, and don't drive past there, Bill, to get a picture of that, please. But anyway, I mean, there's lots to save and lots to fix. I'm deeply concerned about our national debt. I did not run for an office to address as a national debt, but I think the state of North Carolina needs to fully understand how vulnerable we are to a federal government who has an addiction for money and cannot control its appetite. I think that's a very serious concern, especially when it translates ultimately into inflation, which is a thief for our lower and fixed income people of our state and drives up the cost of business for the state itself, which is the largest business in the state. So lots of things that need to be saved, need to be fixed, but I've never seen an award given to anyone who actually cuts debt. I've seen awards given to a lot of people, but we're proud of the work we've done at the Treasurer's Office. We are in the process of retiring 60% of the state debt, 60 over an 8-year period of time. And that's why I said that I think the State of the Union is in peril. It's going to have to be states of the union that keep this country together. And I don't say that emotionally. I sure don't say it politically because both political parties are responsible for this. But I do say it mathematically. Right. Got a follow-up, Connor?
All good, thank you.
Thanks for joining us. Any other questions? Just raise your hand if you have another question. Well, we know there's a lot going on today. I really, what number of Ask Me Anything is this? 87. So 87th consecutive Ask Me Anything. And appreciate staff making this jump up on the table. I think it's important when you're the keeper of the public purse to actually be willing to answer questions from anyone on any topic. We don't know who's going to be joining these calls, and we do not know what the questions are going to be, but we do it, and we think this is a model for other state agencies. I think every state agency should be willing to do this. Sometimes we have 15 or 20 people on these calls, and sometimes they ask me about the pension plan. Sometimes it's about dredging in the Outer Banks. It can be a variety of topics, and my good friends from Elizabeth City understand that all across the board. So we appreciate the time that you've put into joining us today. And as always, if you have any follow-up questions, feel free to reach out to our CRAC communications team, and we'll be glad to answer those questions for you. And want to hope everybody has a great spring, and we look forward to joining you next month.